Um, there is this narrative that is circulating that so-called black folks are dying at a higher rate from this COVID-19. From your perspective, do you see that to be the truth?
No, ma'am, that's not the truth.
Really?
No, ma'am. No, ma'am, that's not the truth. Absolutely not. Most of the people that I have experienced is basically of other nationalities, more like Caucasians, or I've even seen some Jewish people that
which is still Caucasian.
Yeah, exactly.
Right.
That, and I've seen like not many like people from Japan or China, as they would call it. I've seen Chinese, but I haven't seen them behind in the beds. It's mainly Caucasians, and
Really?
yes, ma'am. And they're labeling everybody as to having this COVID-19. Even though they come in with other different issues, they usually have other underlying issues, and it don't even have anything relative to it, in which some of the tests that they're administering to test them to begin with, it must be some type, from what I've observed, it seems to be some type of error with them. I don't think they're really genuine, because everybody cannot have the COVID-19 and receive some of the medications that I have seen administered, and some of the tests that they're doing. It's just like I said, I'll keep that at minimum, but it just
Are you saying are you saying it is your assessment or opinion that the tests are not accurate?
Correct.
Or there's something wrong with these tests?
That's correct.
And you're saying that everyone that comes into the hospital to get treated for whatever illness, it could be diabetes or hypertension or heart disease or whatever, you're saying all these people are now getting tested, getting labeled as coronavirus patient? Is that what you're...
That's exactly what I'm saying. And it has nothing to do with that. So in the area that I work in, we mainly deal with the patients on a one-to-one type deal. And so you can't have no more than 3 people at a time. So the thing is, when you come in, I'm knowing the reason that you came was an underlying cause. Like you may have bronchitis, or you may have asthma, or you may have hypertension, or you may be a congestive heart failure, to that nature. And so you really came in for congestive heart failure, but because you're coming into that environment, now you are considered COVID-19. One situation I would relate to you would be an elderly person. I haven't seen but one African American person, and that one person was from a nursing home. And because they was in the environment, now they're COVID-19. If somebody died, and it can be something to the nature of a heart attack, you're still considered COVID-19.
Wow.
I'm not going to deny that there is not a COVID-19, because yes, it is a COVID-19, but not everybody that they're labeling with that, the numbers are being falsified.